Welcome to the Deep Dive. Today, we're looking into a public health story it's both surprising and really important. It's about measles. A disease many of us probably thought was pretty much a thing of the past here in the U.S. It was officially declared eliminated decades ago, but it's back, and it's back with a concerning surge. So our mission today is to unpack how and why the U.S. is seeing its highest measles case numbers in over 30 years. We want to explore the true dangers and, understand what this all means for you and for our global community. Get ready for some, frankly, eye-opening facts. Let's kick off with the hard numbers. They really paint a clear picture. The United States has hit its highest level of measles cases in more than 30 years. Specifically, we've seen 1,288 confirmed cases just so far in 2025. That makes it the worst year since 1992. And it's not just the number of cases. A significant chunk, 13% of these people, actually needed hospital care.
Yeah, and it's really crucial to remember measles was officially eliminated, quote unquote, from the United States back in 2000. Now, that meant there was no measles spreading within the country itself. New cases they were typically only found when someone caught the virus traveling abroad and then came back. So seeing these kinds of numbers now with local spread, it's a profound shift and honestly a really worrying development.
And the spread, geographically speaking. Where are these cases popping up? Is it everywhere?
Well, they've been reported across 38 states nationwide, so pretty widespread. But there's a definite concentration. Get this, a striking 753 cases in Texas alone. We've also seen 27 distinct outbreaks reported in 2025. And here's a key stat. A staggering 88% of all confirmed cases are directly linked to these outbreaks.
Wow, 88% outbreak associated. So who exactly is getting sick in these situations?
Right, and that brings us to maybe the most crucial point from the data. 92% of these confirmed cases are people who are either unvaccinated or their vaccination status is unknown. This speaks directly to the core of the issue we need to dig into. It really highlights the vulnerability of those without vaccine protection.
Okay, these numbers paint a stark picture. Measles is definitely back. But the big question, the one everyone's asking, is why? Why is a disease we thought we'd beaten making such a strong and, frankly, worrying comeback?
If you connect the dots, health officials are pointing to basically three primary reasons. First, falling immunization rates. Second, the widespread influence of vaccine misinformation. And third, a concerning number of missed childhood doses. For instance, measles vaccination rates among school kids in many parts of the U.S. have dipped below that critical 95% mark.
That's the level needed for good community protection.
Exactly. Robust community protection or herd immunity. And in some areas, it's fallen as low as 90%. It's quite low.
You mentioned missed childhood doses. Was there something specific driving that? I mean, how much is tied to, say, the COVID-19 pandemic? Did that disrupt things?
Oh, absolutely. The pandemic played a significant role, yes. It's easy to just point fingers at vaccine hesitancy, but a really critical, often overlooked insight is how the pandemic just inadvertently dismantled routine public health operations. Think about it. Millions of kids simply fell out of the system, not always because parents refused vaccines, but often due to access issues, clinics closing, healthcare systems just being completely overwhelmed by COVID. They missed routine shots, and sadly, many families just never caught up. And then, compounding this, you have, of course, the false claims about vaccine safety spreading like wildfires, especially on social media. This has definitely fueled fear and confusion, particularly among younger parents, and it's clearly influencing their decisions about vaccinating their kids.
Okay, so we have lower vaccination rates, missed doses, misinformation. Now, some people maybe listening now might still think of measles as, just a harmless childhood rash, something kids get over, but that's not the full story, is it?
No, not at all. And that's a really crucial part of understanding why this comeback is so serious. Measles is far, far from harmless. It can cause severe disease, very serious complications, and tragically, even death. We're talking about problems like dangerously high fevers, pneumonia, which is a lung infection, encephalitis, which is brain swelling, that can lead to permanent brain damage, and also long-term disabilities like deafness or even blindness. It's serious stuff.
Wow. And you mentioned the historical context earlier, before the vaccine.
Right. Think about this. Before the measles vaccine was introduced back in 1963, major epidemics happened like clockwork, roughly every 2 to 3 years. And globally, they caused an estimated 2.6 million deaths each year.
2.6 million deaths a year. That's just staggering.
It is. And even just in the United States, before widespread vaccination, an estimated 48,000 people were hospitalized each year because of measles, and between 400 and 500 people died every single year.
That really puts into perspective what we've managed to avoid for decades. And it makes you wonder, How easily does this thing actually spread?
It's incredibly contagious. Measles is, quite simply, one of the most contagious known diseases in the world. One infected person can spread the virus to as many as 18 other susceptible people. That's an extremely high transmission rate.
18 others from just one person.
Yes. And what's remarkable, really, is how effective the MMR vaccine is. That's the one protecting against measles, mumps, and rubella. 2 doses give about 97% protection. It's incredibly effective. This mass immunization effort, getting that coverage high, that's precisely why measles was declared eliminated in the U.S. back in 2000. But now, well, now that hard-won progress is visibly slipping away, and most people getting sick in this current outbreak are, as we said, either unvaccinated or they haven't had both doses. They're undervaccinated.
Okay, so the U.S. is seeing a major surge. Is this just happening here, or are we seeing this elsewhere too? Is it a wider global trend?
That's a really important question and definitely something for you, the listener, to consider. The U.S. is certainly not alone in this, not by a long shot. Countries across Europe, Latin America, Southeast Asia, they're also experiencing sharp rises in measles cases. Just look at the Americas between January and April 2025. 6 countries in North and South America reported over 2,300 cases and, sadly, 3 deaths. That's 11 times more cases than reported during the same period just the year before in 2024.
11 times higher in just 1 year.
11 times. And tens of thousands of cases have been reported in East Asia and the Pacific, especially hitting places like Vietnam and Mongolia hard. Even countries like India, which haven't seen a major measles outbreak this year, are considered vulnerable. Health experts are warning quite clearly that no country is truly safe if vaccine coverage drops, because all it takes is international travel, bringing the virus into places where that community immunity shield is weak.
Right. So, with all this in mind, the rising numbers, the reasons behind it, the very serious health risks, what does this resurgence mean for us day to day? And maybe more importantly, what can actually be done? What steps can we take to reverse this really concerning trend?
Well, the message from health experts is pretty clear. Act now. Don't wait. They strongly recommend checking vaccine records for yourself, and especially for your children. If any doses were missed, getting those catch-up shots is absolutely vital. It's never too late to catch up. It's also really critical to, well, ignore the vaccine myths you see spreading, particularly on social media. Seek out credible sources and support campaigns that spread accurate awareness about routine immunization. Beyond just individual action, experts are also highlighting the vital role of local community leaders. Think schools, religious groups, trusted local doctors. They're key in rebuilding vaccine confidence, especially for those families who might have fallen through the cracks during the pandemic disruptions. It shows us public health really is a grassroots effort, So the core message is straightforward. Trust the science, stay informed with reliable information, and make sure your vaccinations are up to date.
What a deep dive. This is such a critical public health issue. The story of measles making this kind of comeback in the U.S. years after we declared it eliminated. It's just a powerful reminder, isn't it? A reminder of how easily these hard-won public health victories can be undone by, well, by declining vigilance and the really insidious spread of misinformation.
Absolutely. The return of measles really serves as a clear warning sign. It illustrates starkly how fear, sometimes neglect, and pervasive false information can genuinely undo decades of incredible progress. And it raises, I think, an important question for all of us listening. What collective responsibility do we hold? What role do we each play in safeguarding the well-being, not just of our own families, but of our entire communities?
Something important to think about. Thank you for joining us on this deep dive. Stay informed, stay curious, and we'll see you on the next one.